1450 FM 99.3 KNSI. We are back. More with Your Health, produced in association with CentraCare. Today, ladies and gentlemen, we're going to talk about your children, headaches, pediatrics, common types of head pain, what causes head pain, perhaps most importantly, some of the remedies for head pain. We have an expert in the studio. Her name, Liz Rende. She is a pediatric nurse practitioner with CentraCare. Liz, it is great to meet you. Thank you so much for coming in today.
Pleasure to be here.
Where can we start this conversation? I think everyone with children knows they have an issue. They have a pain here. Sometimes it is so hard to get the children to communicate what's going on. Do you have any tips for mom and dad?
Well, first of all, headaches are extremely common. Probably 75% of children will have at least one headache by the time they're a teenager. Mm-hmm. But fortunately, many of those children don't need advanced consultation or further evaluation.
When you start sitting down and you're talking with kids and you ask them, where does it hurt? How much, on a scale of 1 to 10 and all that kind of stuff. That works for moms and dads, right? Because we know. But how do you get the kids to open up and start talking?
So that's really challenging because a younger child may actually have difficulty telling you about their headache.
Right.
So you have to rely on parents who tell you that a child goes to bed when they have a headache, or the teachers send them home because they just can't pay attention or they can't remember things. Particularly migraine headaches are often associated with vomiting in early childhood.
Right.
So that's an easier symptom to be able to report to a healthcare provider.
Health history. How long has this been happening? When did you first notice it? That kind of thing?
Absolutely. And so the history is essential, whether a child's 4 or 5 years old or 15 years old, because if we don't ask the right questions, we are not going to get the answers that we need.
Is there a commonality when it comes to pediatric head pain, or are they like grown-ups?
Well, we all know that kids are not little adults, so I think they do have some unique qualities to their headache, but children can have migraine headaches. They are very similar to adults with migraine headaches.
So you've mentioned migraines a couple of times, right? To me, that is the Mac Daddy of all headaches, those migraines. But there are other kinds of head pain that a child will undergo, right? Or experience.
Absolutely. So just a plain headache. Unfortunately, the diagnostic criteria calls it a tension-type headache. But we just call it a regular headache compared to a migraine headache. But kids can have headache associated with illness. And that's very, very common. They may have strep throat. But they may have a headache that goes along with that. They may have, high fever. Even a gastrointestinal illness with fever may also have headaches. So, again, that's important to sort out.
One of the most common causes of headache when I was a child were swing sets and monkey bars and those kinds of things that we would bonk our heads on, and we'd end up with a ginormous goose egg on our forehead. Of course, those days, treatment was a wet paper towel, right? Moms and dads now are so much more aware of things that can happen, a bump on the head, or, maybe they're just wrestling around with a brother or sister on the living room floor or what have you. Do you see this kind of stuff coming from school situations, a bump on the playground or sports or something like that?
So I think that those children are often first assessed either in the emergency room, urgent care, or their primary care provider. They may never get to someone like me housed in neurology because they get a bump on the head. They're instructed to ice it, keep an eye on the child. Is the child sleeping too much? Is the child vomiting? Other signs of a more severe injury. But most of the time, the bumps on the head look worse on the outside, and they get better quickly. I don't understand how that can be, because sometimes they're like the size of a half a tennis ball or something. That's right.
Boy, kids are resilient, aren't they?
Absolutely.
When is it time to come and visit Liz Rende?
So most of the time, parents are seeking additional recommendations when a headache doesn't get better So that's the first thing, all right? Parents are noticing that they're complaining of more and more headaches. Another time that would be appropriate would be if they're missing school. Their school performance is deteriorating. They are not able to play basketball. They're not able to go to gymnastics. It's really affecting the quality of life. They may have difficulty with sleep. They may get behind in their work.
Any vision problems?
And vision problems are often associated with migraine headache, but not in general with other types of headaches.
Do little children, and how would you know? Because how would they tell you, right? But do little children get migraine headaches? Can you tell?
That's a great question. So children as young as 2 or 3 years old may actually develop migraine headaches.
Really?
But you can imagine that it is much harder to get an accurate history and to try and determine exactly what kind of headache this is, or more importantly, to exclude other causes of headache that we wouldn't want to miss.
Finding out what it's not as opposed to what it is. And that can be as beneficial, can't it?
Absolutely. And very, very reassuring to parents.
I was just going to say, and mom and dad feel a heck of a lot better for sure. Liz Rende is our guest. She is a pediatric nurse practitioner. We're talking about your kids and their headaches. You're listening to Your Health, AM 1450, FM 99.3, KNSI. We'll be right back. AM 1450, FM 99.3, KNSI. We are back with more of Your Health. Health expert, pediatric nurse practitioner Liz Rende is in studio with us. We're talking about your kids and their headaches. Now, Liz, I have to ask you to differentiate for me, if you will, the difference between a regular run-of-the-mill headache and a migraine headache, okay?
Okay, well, not to bore you with fancy definitions, but there is an international classification of headache disorders, and they create diagnostic criteria. So simply put, that is a list of things that need to be present to give it a particular headache type name.
Okay.
So first, let me address the migraine headache. Migraine headache is a headache of moderate to severe intensity associated with nausea and or vomiting, light sensitivity or sound sensitivity, and aggravated by physical activity. So that's what makes a headache a migraine versus a tension-type headache. And a tension-type headache can have some light or sound sensitivity. Kids can be nauseated with a tension-type headache, but they probably aren't going to vomit. And the key difference is that kids with regular headaches can play basketball, go play soccer, go to gymnastics, stay in school, versus kids with a migraine headache usually are debilitated where they have to come home and sleep. They have trouble concentrating, being able to do what they need to do, and certainly physical activity is going to worsen it.
And we know from being kids, raising kids ourselves, right? Kids are going to come up with a million ways to not go to school, reasons not to go to school. But moms and dads are going to be able to tell the difference right away, aren't they?
Absolutely.
Yeah.
Absolutely.
Very good. Okay. How about testing procedures? How do we know this person has this degree of migraine, this one or the other one?
So one of the benefits about being able to define what a migraine headache is, and I won't bore you with the pathophysiology, but it is quite different. And we now have scientists that have well defined the process that happens in a migraine headache. Okay. So regarding testing, we know that keeping track of a calendar is super easy and really important for us to see if that headache is changing in any way.
What should we write down on that calendar? Just a date and time? How about something they ate, activities they did?
So what is most helpful is the context in which the headache occurs.
Okay.
So is it happening before Sunday night, before going back to school on Monday, or after a stressful exam series? Keeping track of the time of onset of headache and when the headache goes away, what they give for the headache, and not necessarily what they eat. we now know that food triggers are not as common as we once thought. Likewise, other triggers, probably eye strain used to be a concern of parents years ago. And now we know that while a good eye exam is important, it's not likely to be the primary cause for headache, especially migraine. And what we now know, too, is that migraine headache is often familial. In some types of migraine, it's actually genetic, meaning that we've identified a particular genetic abnormality, but they do run in families. So it's reassuring to hear a family history of other individuals.
Boys, girls, both, doesn't matter?
So boys and girls, pretty even Steven in elementary school. Mm-hmm. In middle school, the boys' headaches get less often. Okay. And girls' headaches, as they go into high school, they tend to be more frequent than the boys. But migraine headache is a lifelong disorder. Yeah. It is not something that kids outgrow. The pattern may change, the severity may change, and wax and wane throughout the course of life, but they don't outgrow.
Do you find once you're able to latch onto these triggers, do they run from person to person to person? Are there commonalities that way?
So probably stress is the number one trigger for both tension type and migraine headaches. All right, dehydration is important. Sleep. And I think we are going to hear more and more about sleep affecting chronic illness of all sorts, not just headache. And regular eating, exercise, screen time. I think that's a hot topic.
Thank you. It is a big deal.
It is. But I still think that there are some children that are a little more resilient and other children that we have to pay attention to.
Yeah, just like grown-ups, right?
Yes, absolutely.
How about, you talked about the particular stages of growth, whether it be elementary school, middle school, senior high, what have you. How about hormonal changes that are going through teenagers? Because, boy, they're on fire with all sorts of things that they don't even know what's going on, right?
Absolutely. And that is probably largely responsible for why teenage girls have more headache. The male hormones do not really make a big difference with triggering migraine headache, but certainly in the girls.
AM 1450, FM 99.3, KNSI. You are listening to Your Health. Our special guest is pediatric nurse practitioner Liz Rende. And we are talking about your children, what we are going to, and their headaches. What we're going to do after this next break is come back and talk about over-the-counter remedies. You mentioned sleep, getting more sleep. You mentioned dehydration, getting your kids to drink more water. Some of the habits that you may not even know can be changed to improve the health of your kids. You're listening to Your Health. 1450, FM 99.3, KNSI. Liz Rende is a pediatric nurse practitioner. Her specialty is headaches, kids' headaches, whether they be the regular, and I'm just going to call them a regular run-of-the-mill headache or a migraine headache, Liz. But before we get into over-the-counter remedies, that sort of thing, how mom and dad might choose to treat the kids, let's get back to that whole testing thing. And typically speaking, parents are going to be wringing their hands. They're worried about Johnny or Susie or whatever, right? What typically happens when they come in and talk to you? Are there a series of tests that you automatically order? Are there a series of tests that they automatically assume will be done? What happens?
So fortunately, over time, the last 20 to 30 years or so, we have good evidence that tells us what we need to do or what we don't necessarily need to do. So certainly if a child has a first-time super bad headache, they're going to end up in the emergency room, which is the right place. Mm-hmm. It's frightening for parents. It's frightening for the child. And at that time, they may choose to do an imaging study, probably a CT scan because it's quick. And just to make sure that they're not overlooking a cause for that first-time headache. Okay. On the other hand, children may come into the emergency room and with a typical migraine headache. And while parents may expect imaging, if a child has had headaches for a while, if they've had documentation of normal exams, and they've got a normal neurological exam in the ED, they're not necessarily likely to get imaging. Now, from the outpatient perspective, when we see children in the clinic, that is often a subjective decision by the provider, but the guidelines that we currently use are children that have had headache for 6 months or longer. They have a normal neurological exam, no red flags in the history. We do not usually image.
Okay.
And that is really to safeguard radiation exposure from CT scans. And these younger children often may need sedation. And we want to avoid that, as well as they're really, we know now they're many of these children are perfectly normal. They have normal MRIs.
So moms and dads, think about this. Your child has some head pain. Again, the family history, very important, the child's history.
Absolutely.
So this is going to happen 2 or 3 or 4 times before the light comes on and mom goes or dad goes, wow, this is kind of happening a lot. I'd better start writing this down. Is that very important to do?
Yes. A headache calendar is the best thing when we evaluate a child in the very beginning.
Now, you had mentioned when parents bring the children in, you ask them, okay, what have you given the child? Typically speaking, what could we be giving our son or daughter that may be having some severe headache issues?
So first and foremost, this is something that primary care providers should be involved in, because that is where they are most likely to seek additional advice. Over-the-counter medicine is certainly appropriate unless there is another reason why they cannot take a certain type of medicine. But Tylenol and ibuprofen or acetaminophen and ibuprofen are perfectly fine, and their primary care provider can tell them the appropriate dose. That is a medicine approach, so something to make the headache better.
What about aspirin?
Aspirin is no longer recommended, and the primary reason is because it can cause stomach upset. And it is, while it may be a good pain reliever, it is not really a first-line medicine.
Anybody who watches the news, the evening news, they are inundated with healthcare commercials, right? This medicine, that medicine, whatever. I see all of these migraine medications that are over-the-counter for the most part, right? Migraine strength. What are those?
So usually they're a blend of something with caffeine, acetaminophen, and ibuprofen. Some have aspirin in them as well. Generally, in younger children under the age of 11 or 12 should not be using those combination medicines.
Aspirin particularly, right? Isn't Reye syndrome? Aren't we worried about that?
So giving aspirin to a child who may have a fever, who is otherwise sick, puts them at increased risk for developing Reye syndrome.
Are there any other things? I think of massage therapy, for example. Does that work with kids?
So interestingly, there's a group of what we call complementary or integrative medicine approaches, and those are often adjunct or in addition to the other treatment plans. So complementary approaches can include, as you said, massage, yoga, mindfulness, biofeedback, cognitive behavioral therapy, even hypnosis. And these are all kind of extra approaches to treat pain and help kids feel better.
Liz, we've covered an awful lot of ground here dealing with kids and their headaches, their head pain. You said it best, I think. It all starts with the primary physician, right? The primary care physician, that child's doctor, their pediatrician, right?
Yes, absolutely.
How do parents know when it is time to bring their kids to see that doctor? And then how does that doctor know when it's time to make the referral to you?
So I think that parents should consult their primary care provider if the headache is causing any kind of disability, any kind of concern, whether it's on the part of the parents or other caregivers, or the child themselves. Children can become very frightened about the meaning of headaches as well. So consulting their primary care provider, who is their friend, would be the first stop.
And also, mom and dad, think about the talk. Think about your conversation. You think your kids aren't listening? Oh, my. They hear everything you say. So think about that conversation you're having between the parents, right?
Right.
Okay. All right. So that pediatrician, that primary care provider, when do they know that it's time to go up the ladder, so to speak, and contact you?
So first and foremost, they would likely make a referral if they are also concerned about the type of headache or the cause of headache. They may not decide to treat and wait and see how things go. They may refer right away, or they may instruct parents to keep a calendar and try some over-the-counter medicines and watch the headache over time.
Sure, but we've talked about this before earlier in the conversation. Mom and dad, you could be already ahead of the game by having that calendar that's already been filled out, right?
Absolutely.
Okay.
It's a huge help.
Very good. All right. Moms and dads have been doing their job. Their son or daughter goes to see the pediatrician. The pediatrician says, well, it's time to make this referral. That's pretty much how it goes, right?
Absolutely. I think keeping the primary care provider involved is essential because they may consult with neurology, but we eventually are going to ask them to follow up with their primary care provider. So keeping that primary provider in the loop is essential.
Very important. Liz, thank you so much. Appreciate all the information today.
Thank you so much for this opportunity.
Liz Rende, pediatric nurse practitioner, our special guest today on Your Health, AM 1450, FM 99.3, KNSI.